We are talking prostate cancer as we should in this month of November. Doctor, good morning and thank you.
Good morning, Vikendi. Good morning, Lewe. Thank you for having me. Good morning, listeners.
Wonderful. It's good to have you. Why is it important for us to talk prostate cancer in this month of November, at this particular time of the year?
We should be talking about prostate cancer every day, 365 days a year, not necessarily in November. But we've chosen November because we're just coming out of the breast cancer awareness October. So if you go into November, we also want the momentum to go on into the men's side. Prostate cancer is a very slow growing cancer. And it's very important that we talk about it, especially in this month of November, if we can.
Okay. So maybe to start with just the definition of what it is. Yeah.
We should start with the definition of cancer. Cancer is an abnormal growth of a cell. We are born with normal cells. But the moment there is an abnormal growth, which means if your body starts to produce an abnormal cell, that becomes cancerous. So for prostate, a prostate is an organ that we have, especially as men. So I'm going to emphasize on that as men, because we've got women, our men that have decided now to become men, or men that have decided to become women, and we don't remove the prostate cancer. The prostate gland. So it's very important that those that are transgender that thinks that they are women, but they are men, because they still got the prostate cancer, they are equally affected as men. So a prostate gland is a gland which is almost the size of a walnut. And atakupa means and so in Shona, like hatch.
Okay.
And then you put a straw, like the one that we use to drink drinks water. That's your urethra. So it sits just below the bladder. And it's very important in terms of production because it releases a fluid that helps the semen or the ejaculate to be alive in the birth canal, especially after intimacy. So every man's prostate grows, especially after the 20 years when they start becoming reproductive, because it uses the testosterone hormone to grow. But who is at risk? We are all at risk because we are men. That's number one. Those that are above 50, they are at risk. Those that are above 80, they are at more risk because of age. And because we are blacks, we're not talking racism here, but we're very unfortunate that blacks, we suffer prostate cancer more than any other race. So being black is also a disadvantage on our side.
So I've heard that it's inevitable for men in their old age to get prostate cancer. Is that so?
Yes and no, Vikendi.
Okay.
It's a no because most men, they start to develop what we call benign prostatic hypertrophy. The prostate just grows, but it's not cancerous. The moment it becomes cancerous, that's when you start having symptoms.
Okay.
Yes. So the symptoms that you have, if I can talk about those ones, poor stream. You discover as a man, you go to the toilet and you're urinating and your stream is very poor or is very weak. That's number one. Or you're just difficult in passing urine. That's number two. Or sometimes you're passing urine and then you see blood. Not terminal blood, like you're about to finish urinating and then you see blood, but the whole stream of urine will be bloody. Or you find in your ejaculate after intimacy, you've got blood in your sperms. Or again, you get painful urination, or when you're seated, you get pain in the groin. Because remember what I said, this prostate is under or just beneath the bladder. So when you sit down, you put pressure on it, that is, you start to grow. And then when it started metastasizing, which means it started to spread, you get lower back pain, chest pains, or even hip pain. So these are some of the symptoms that men suffer. But not all men will get prostate cancer.
Or even in their 80s, even in their 90s.
Some will just get just an enlarged prostate without any cancer.
Oh, that's not cancerous.
So it becomes cancerous when you do a test. This is what most men fear. A lot of men, they fear coming up front to have a prostate screening. Because what we just want is to catch the cancer whilst it's still in its infancy. It becomes very easy to treat. So the test that we have, we've got a blood test, which we call PSA. You come in, we take blood, and then we measure the prostate antigen, specific antigen. This one usually is normal. You are between 0 and 4 nanograms. But when it's above 4, that's when we say, please go and get in touch with your doctor. And then we have got another test that a lot of men don't want. That's we call digital rectal examination, where a physician or a doctor wears their own gloves and then they insert their finger at the backside and then they try to feel the prostate. Because the prostate, remember, is just below
backside of a man.
Yes.
Okay.
At the backside of the man. So a lot of men, they run away from us because they fear that test.
Yeah.
But if your PSA is high, we can always suggest, if you're not comfortable with that test, we can suggest that you come in and you go for an ultrasound scan of the prostate, which will give us values. If it's less than 20 cc's in terms of volume, we are normal. But if it's above 30 cc's, then we say now your prostate is enlarged. And then you need to be seen by a urologist, which is a specialist. We do the screening, then we refer you to the specialist for further management.
So when it comes to the age where a man should be, I don't know if you had mentioned it, should be concerned, in knowing from what age?
What age one should come?
Yes.
Yes, that's a very good question, Vikendi. We have patients that come in because there's a positive family history of prostate cancer. So if there's a positive family history, you can come in even in your 40s. But we usually recommend that if you're above 50, just present yourself to a wellness program, present yourself to a GP, present yourself to your doctor or a clinic, and you have your PSA if you're above 50, your PSA and a digital examination if you are comfortable with that, or just an ultrasound scan.
Okay, but then for someone who is younger, Tomboti, someone in their 30s, 20s, they can't have prostate cancer. Symptoms, urine, like, could it be something else?
Yes. Remember, people, they start becoming very, they start their intimacies around 18 years, 20 years, some around 30 years as well, the late ones. So if they are feeling that they've got issues with their reproductive system, they are having challenges, they're having urine that is hot, which is what we call dysuria in medicine. They can come in and then we do a urinary test. They give us their urine and then we send it for tests. And then we discover what the problem is. But we should ask men to present themselves early. Any problems with your system, any problems with blood in your urine, burning urine, frequency in urination, please present yourself to the nearest health facility.
We're going to take a musical break. We'll be right back. You can come with your questions. Remember to specify your age, your gender, so that the doctor will be able to guide and give us as much information as you can. We're talking about prostate cancer, and if you have questions around that or just to do with your health, feel free to hit us up on 0772 162 651.
Empty your mind. Be formless, shapeless, like water. Now you put water into a cup, it becomes the cup. You put water into a bottle, it becomes the bottle. You put it in a teapot, it becomes the teapot. Now water can flow or it can crash. Be water, my friend.
Yeah, don't come to me when my claims as in a proof. Or talk about them days when it rained, this in a roof. Let me be that this my bodies, but I never rake your home. I won't keep you with it down, I'd rather fight you with inform. Nowadays I perform, doing the boys round the crowd. Last year by one day, roll my freestyle, didn't class. Last year by one day, pick it an earphone, didn't buzz. Backseat, that's if, kinda casket of a line. Yeah, pussy got bamba face, thing, book with the dust. My Jesus in a plan, my deals are sing a family. My choose this in a baeko, only this in a tambi. It's painful, Jarisha Mira, I know Jarishi on glass. But now, my awards are the same, drawing it down. Last year, by one day, Miss a combi in the town. So I can place it, very fine, very bold. After Nanza Nyaya Zao, then I start to wonder, Munu, where people join me up a struggle, we are better. Chatting for courage, you please, I'm my prayer. Okay, it's fine, but it's still my day. After Nanza Nyaya Zao, then I start to, yeah. Vegas same clothes every day. Same songs every day. Six songs, we spay up, that I'm same room, never choose. Same people you love, that be same people fuka. Yeah, too much weight can read in that day and I muka. Yeah, Jonesy votes, swear we jam up on my scene. Check up on my list, plus to catch up on my deal. Easy pressure problem, mazo pa my ops, yeah, zip sasa. Problem, I'm gonna filter bago sasa. Yeah, baza gunza dombo kuma youth. Mari muguztora mwine rufu pa my foods. Kumkashaiwa business ngohoda ika my fruits pambiles. I think tabone kumukira kuma finance. Still my awards that I'm same drawing gown. Last year ba wana emisa kombi ndiri mtown. Saga
Unozongo da ungofunga also. Ndiani wewe unoziva akabatsirwa nemutoriro? Hapana. Saka madrugs unomadi. Siyana nazo.
Stop drugs before they stop you. This message is brought to you by the Zim Papers Radio Broadcasting Division, supporting the government of Zimbabwe in the fight against drugs.
And before we continue, Doc, I'm just going to take some questions here. And good morning, Doctor. What causes bleeding at ejaculation? Lots of blood come out, dark red with clots. A male, 54 years.
That's a very good question. Like I said, if you're passing out blood, either urine or as ejaculates, you need to be seen by a doctor, because one of the causes of, or one of the signs and symptoms of prostate cancer is also having blood in your ejaculate. Also, if you damage yourself or trauma to your groin, you can also present with blood. We also need to see if you had not done a penile fracture during your intimacy. So it's very important that if it's an acute problem that you just faced and you are passing out blood, please be seen by a doctor immediately.
Anzi, Doc, my PSA has been high for some time now. I've been doing all those scans and all the tests you referred to. Results say my prostate is normal size. I get checked twice a year. I don't have problems with urinating or emptying my bladder. Just frequent peeing, especially at night. My doc says at 60 it's not abnormal. Should I be worried? I've seen more than 3 doctors on same issue, same results.
Yes. If you've done your PSA and it's high, we had not gone on treatment, but there's a score that we use, which we call the Gleason score. This score will assist you in terms of your PSA. If your PSA is high and you don't have any symptoms, you are put on surveillance. Surveillance is when we don't do anything to you, nothing is done, no chemotherapy is done, because all the other tests would have shown that there's no cancer. So what you just have is a high PSA. So when you go for your routine test, make sure they do a urinary test to see if you don't have a urinary tract infection, or you don't have a prostatitis, which means an inflammation of the prostate, maybe due to bacteria, or you had the test just immediately after intimacy. And also you would also need to check your testosterone levels, because if your testosterone levels are very high, you might also have an incidence whereby you have a persistent high PSA. So it's good that you're doing surveillance. It's also good that you've had a few second opinions on the condition, as long as your prostate doesn't have anything inside. The other option, which would be the last resort, is to have a biopsy. That's where they take a piece of meat and then they send it to the labs, and then they will look to see if there is something that is minute and that could not have been picked by the ultrasound scans.
Okay. I think you really explained it. Anzi Chamber, thank you for this program and information. Just want to ask, where actually as men can we get screened, and is it for free? Women are screened regularly for free. Can that cancer also, and then they go on to ask, can that cancer also affect sexual desire or performance? I'm a concerned patient, 54 years, a man.
You're above 50, so you're a candidate. You have a screening test. In terms of prostate cancer, when it has developed, yes, obviously it will affect your reproductive age. You become impotent sometimes. Your desire might be lower than normal, because remember we said a cancer is something that is an abnormal growth. If it's a growth near a nerve, which is responsible for an erection, which is responsible for any other things down below there, you might have effects. But the second question which was asked, can the test be done for free? Yes, we have got partners that are offering PSAs and ultrasound scans for free. Then we have also wellness programs that have been conducted by companies, and then we have wellness programs that have been done in this month of November. So if you go through Facebook, you go through the Ministry of Health platforms, you discover that there are places where this processes are done. But if you've got a GP or you've got a health center near you, you can go there and request for a PSA and an additional, maybe an ultrasound scan if you're afraid to have a DRE, which is a digital rectal.
So digital erectile pana kunyatsovunza for you to explain. And is it true when a physician tests you for prostate, they insert the finger inside your back there, and some men might ejaculate instantly? And if it's true, I would not allow another man to run a test on me.
There is no evidence that you ejaculate. That's number one. Number two, they put on a glove, that's the process. They put on a glove and then they put a lubricant. Why are we putting our fingers at the backside? Is because the prostate can be felt easily from the rectum. The rectum is the last part of the colon, of the intestines, just before the anus. So when you feel with your finger, you are feeling for roughness, you are feeling for smoothness, or you are feeling for enlargement. So your finger will be going through the surface, but there's no evidence that you ejaculate.
Okay. Okay, so, but then it's a bit uncomfortable maybe for some.
Yes, kind of really uncomfortable for some men. Remember we said we do the PSA, which is the blood test, which will give us the value, which should be normal if it's less than 4, and abnormal is above 4. And then if you are uncomfortable for the DRE,
not how long dog who pins and
it depends. If men also, you remember this is an invasive procedure, you're putting your finger inside the rectum. So obviously we've got an anal sphincter, which has got a normal control. Someone can actually squeeze through. And then there's nervousness, which can actually make the procedure very uncomfortable. But if you relax, you breathe in and out, it should take us less than 3 minutes.
I guess it's like that potato COVID test, pokwa, and then it's in and out. So yeah. And last question before you continue. Keep the questions coming. We'll continue to ask, but then the last one before you continue to explain to us about prostate cancer. And is it true that having sexual intercourse regularly every day helps to reduce the risk of getting prostate cancer?
We support intimacy. It makes the relationship stronger. So when you look at breast cancer, we say that those ladies that breastfeed, they've been actually found to have a low incidence. With prostate cancer as well, we have seen that those that are in relationships that are in intimacy, if I may say that, as long as there's no family history, the incidence is on the low side. But it's not every day, every hour.
Oh my gosh, yeah, no, I understand. Because some may actually take it literally,
yes.
And a madam Kumbogu, and a guy told you, prostate cancer and squeeze, you know what you should do. So, we continue from where we left off, Doc. We can continue as you're explaining. Kunwarka questions, 0772162651. Keep them coming. Remember to specify your age, your gender, and mupechiremba information yakakwana.
Okay, for just summarizing for those who are just joining in, we said if you're about 50, you come in for a prostate screening. We are trying to catch the cancer in its infancy. So we do a PSA, which is a blood test, and then we do a digital examination. If you're not comfortable with that one, then we do an ultrasound scan of the prostate. When the figures are high, above 4, we are worried that there might be symptoms or there might be suggestions that you might have prostate cancer, you are referred to a urologist. You will do a biopsy. A biopsy is where you take the piece of meat and then they will look and try to see if there are any cancerous tissue. If the cancerous tissue is there, then we put you in the surveillance mode. Remember the caller who said, I've had my PSA which was high but nothing was discovered. Yes, we can put you on surveillance monitoring. This one is a bit tough because someone will say, but you found prostate cancer on me, but how come you're not treating? We are monitoring you. Some are very slow growing, so we can go for 10 years, 15 years without having been on medication. And some will discover that they've got high risk cancer.
Sorry to interject. Kuti inenge slow growing, but then the symptoms, are they presenting themselves the same, or apana chirikubatika in terms of the symptoms that you shared with us?
Apana chirikubatika, but we are for screening, and then you just discover that you have got a PSA which is high. So what we now do is, if those ones that we have identified in there's a nodule, or maybe there's cancer, we then discuss with the patient. It's very important that you put patients in discussion. We do other radiation therapy where we zoom in and blast the cells, or we can do what we call brachytherapy, where they can do internal radiation. They put radiation material inside the cancer and then they can kill it. And then also they can do surgical removal. They can open just above just on the line of the pubic area, and then they can remove the prostate. There are challenges on removing the prostate though. Remember, we said it sits under the bladder. So you might have struggle with your bladder control. And remember also it involves in intimacy. So you might also have impotence thereafter. That's surgical removal of the prostate or the cancerous part. We can also do chemotherapy where people can be given hormones like or chemicals like Zoladex. That these ones are in advanced cancer, where now we've done screening and then we've discovered these ones are coming in with lower back pains, hip pains, and there's now bone involvement. So these ones now we have to give them chemotherapy to manage the spread and also the growth. And then there is hormone therapy, where, remember, these cells, they can also grow because of our main hormone, which is testosterone. So we need to find a way of blocking that testosterone. But though hormone, so if you block it, then your sexual drive becomes very low, your libido comes down, and also you become impotent. But what we need now is life. It's the quality of life that you're looking at against a cancer that might be spreading. Last but not least, some countries, they are using what we call cryotherapy, where you make them cold, you freeze the cells and they die, and then you're good to go. So you involve patients in treatment, so that they will understand the side effects of every type of treatment that you have put across, whether it's chemotherapy, whether it's radiation. So it's very important.
How aggressive does it get, and also how fast does it spread? And where?
That's a very good question, Vikendi. In the time we go to the doctor, either it's your partner that has discovered that you're spending too much time in the toilet, or maybe you're messing up your trousers after using the toilet, or most probably that you are presenting with low back pain or any other things, and then these things are found incidentally by just coming to the doctors. Cancers are divided into two. We've got slow growing, which we can put on surveillance. They can take a bit of a while for them to really come out. And then we've got aggressive ones, which the moment we discover these ones are aggressive, the adenomas, then we have to rush you through to the chemotherapy and the radiations. So there are different types. Yes.
And for this prostate, like when it's now spreading, does it spread to other parts of your organs, or what happens?
Prostate usually spreads to your back and your chest. So when we say the prostate, the cancer is now spreading, we are saying that it's breaking up itself and then it passes through the blood and then it goes and it settles in different areas. But the most areas that are very prominent for the prostate usually is the chest bones and also the back, the spine. And when patients come in, they will come in complaining about their backs, they're aching, they've got bone pain that they can't describe. So that's when we know that it has spread. When it's done, the spread now, that one now becomes a palliative care issue. You're now looking at quality of life, because there isn't much that we can do except to control the presenting symptoms. You can come with a lot of pain, we control the pain. You can come with other symptoms like muscle pains, we give you medication that can control that, and also to support your intestines, because some might actually present with constipation and diarrhea alternating. So we need to also bring in nutritionists to help you on that.
Okay. Thank you so much, Doctor. We will continue. Going to take a musical break. We'll be right back. It is Wellness Wednesday right here on the Morning Galaxy on Star FM, sounding good all the time. I'm V Candy, and we have Dr. Matienga live in studio. You can also hit us up if you have any questions. 0772162651. Remember to specify your age, your gender, and as much information as you can, so that the doctor will be able.
Down there, and they stretch the nerves. Who knows why painful discomfort in that area. So seek treatment, go and see your doctor. But there is prostate cancer.
Okay.
Let's exclude any STI or any other infections down below.
And my husband has an enlarged prostate. Can he get help? What type of help?
That's a very good question. Vanofana vakaiwana kuti vakaiona sei prostate yachinoti hombe, but kana vakaonekwa nachiremba yaifanira kubva aita PSA. Kana aita PSA, which is the prostate antigen PSA yachona yaitwa, then iri high, then prostate yavo ivanzi iri high, then vanoenda kuna chiremba anonzi urologist, voonekwa kunzi vangapuwa here mushonga wekuishrinka. Kana yashrinkwa, then vanenge vakubatsirikana zvakanaka. Asi kana iri prostate cancer, then vanenge vakurifiwa kuna urology oncologist, which means chiremba anodila nezve prostate cancer.
So benign yamataura iyi inopresentawo through enlarged prostate.
Remember tati prostate yedu glandi kantanga hacha. Asi pipe inorasa mvura inopinda nepakati pikakahachaka. Saka kana yakukura prostate inotanga ichikura ichienda kunze, yosvika pekuti haichakwanisa kuenda kunze, yochitanga kukura ichipinda mukati. Panotanga kupinda mukati ndo panouya masymptoms aya kuti wakutadza kuita weight, wakuzvitira weight, kana kuti wakuputwa kuenda kutoilet, wakuita kana 30 minutes uchirasa mvura. Vamwe vanotobva vachita weight vakagara semadzimai, because vanoda kuisa pressure mudumbu kuti ise pressure kubladder kuti akwanise kurasa mvura. So the symptoms are almost similar. The only difference now is kuti hauna ropa riri kubuda muweight, and hausisina masymptoms emusana ekuratidza kuti inenge yapararira. Benign inoramba yakangoti zvimbe zvayo, but ine normal, sometimes a PSA result.
Okay, I'm going to take the last question before we continue, but then you can keep the questions coming. And good morning, Chiremba. My husband is 60 years of age and he has sugar diabetes. But when he releases gas, he messes his pants. And even when he visits the loo after doing number 2, he still messes his pants. His feet are always swollen and he complains about fatigue a lot and sometimes complains about feeling numb.
Panezva vamwe vana kutaura kuti vakasimbere baba vanenge vari obese, but loss of sphincter, anal sphincter, is a condition that can actually be seen by general surgeons. Is there anything that is going on? A lot of gas. It can also be type of food that they are eating, and also exercise will help. You have sit-ups, sakanyanya, famba, and tone the abdomen. It also will reduce the amount of gas that is inside. There are types of foods that can also increase a lot of gas. One on lactose intolerance that can also produce a lot of gas. So it's important that they are seen, and it's also important that they do a lot of exercises. But chiremba anozoona nezvekutadza kunyatsota tsvina zvakanaka anenge general surgeon.
Okay. So kune early detection doc, munhu anokwanisa kubatsirika here kana matoona kuti iripo prostate cancer zvokutorapika kuti itobva yatobvawo ararame a normal life pasina risk?
Yes, early detection will help us in management. If you do an early detection, your scan is done and they discover there's very significant, or there's a very small cancerous material, it can be removed. We can use hydration, radiation, to make sure that we kill the cells. A patient can actually live a normal life, 15 to 20 years, which is very important. It's only when you've got late detection that's when we suffer the consequences of not able to manage the patients very well. What we call terminal illness.
Okay. We're going to take another musical break and we'll be right back. Keep the questions coming. We have Dr. Matienga live in studio right here on Star FM. The Morning Galaxy, a Wellness Wednesday with Dr. Matienga live in studio, MV Candy. And Doc, talking about prostate cancer, what does life after detection, mean?
That's a very good question, Vikendi. A lot of patients, when you discover that they've got prostate cancer, we need what we call family support. It's very important that They involve every part of their families in terms of care, in terms of support. Because it's a financial burden. They can come in if there is a metastasis. They can come in with lower back pain. They can come in with chest pains. They can come in with so many ailments that will require maybe repeated admissions in hospital. That might require a lot of financial input. So we need a family unit, and we've got palliative care support service providers out there in Zimbabwe that can actually, we don't have to mention names, but they can actually be contacted, and then they can assist these individuals. If you have prostate cancer and it has been treated, you can be okay if it's detected early. You don't have to have any challenges. But if it has metastasized and you have got now a spread of the cancer, that's when we face challenges whereby we need our relatives, we need our individual clients, our patients to have a quality of life, a quality of care life. So the ministry has to come in and provide these services as well. So it's very important. We need to educate our men, especially right now. Places like Anasiaso, places like Anagazaland, places like football stadiums, we should be having billboards that will highlight and also sensitize men, especially on prostate cancer. October was very good. We had so many people that supported breast cancer awareness for women. So we also need November to be blue. For everyone, we should be wearing blue ribbons. We should be going around with cars wrapped around with prostate infoderms, so that at least we are covered. At least people know that this one is real. That we also know that we have above 50. We should be having all these screenings. It's expensive to treat, but it's very cheaper to identify and cure in early stage.
Thank you so much, Doc. Hans, great talk, my dad. Now